In the heart of Philadelphia, at 3801 Lancaster Avenue, stood a nondescript building. This was no ordinary medical practice. This was the site of unspeakable horrors, a place where vulnerable women were exploited and innocent lives were extinguished. This is the story of Kermit Gosnell's abortion clinic, a chilling tale of malpractice, murder, and the failure of authorities to protect the vulnerable. For years, Kermit Gosnell operated his clinic with impunity. Behind the facade of a medical professional hid a sinister reality. Gosnell's clinic was a far cry from a legitimate medical facility. It was a place where profit trumped patient care, and basic hygiene was non-existent. Women, many of them poor and desperate, sought Gosnell's services unaware of the horrors that awaited them. They came seeking help, believing they were in the hands of a trained medical professional. Instead, they were subjected to barbaric conditions and procedures that defied medical ethics and basic human decency. Kermit Gosnell's crimes shocked the nation. The sheer brutality of his actions, coupled with the fact that they occurred over many years, left many questioning how such horrors could go unnoticed for so long. Gosnell was not just performing illegal late-term abortions, he was, according to prosecutors, killing babies who were born alive. Gosnell's weapon of choice was chillingly straightforward scissors. Prosecutors argued that he would sever the spinal cords of babies born alive during abortions. These infants, some born well past the legal limit for abortions, were treated not as patients but as medical waste. The details of these procedures, as described in court documents and witness testimonies, were deeply disturbing. Beyond the murder charges, Gosnell was also accused of involuntary manslaughter in the death of Karnamaya Mongar, a 41-year-old refugee who died of a drug overdose at his clinic. The clinic, already operating under dangerous conditions, was criminally negligent in its care of Mongar. Her death, while not directly related to the infant killings, exposed the systemic recklessness that permeated every aspect of Gosnell's practice. The trial of Kermit Gosnell was a media sensation. The gruesome details of his crimes, coupled with the scale of his operation, captivated and horrified the public. Prosecutors presented a mountain of evidence against Gosnell, including eyewitness testimony from former clinic employees, medical records, and physical evidence collected from the clinic. The defense argued that Gosnell was a scapegoat, targeted because he provided abortions to poor women. They claimed that the babies he was accused of killing were not viable outside the womb, and that his actions were within the bounds of legal abortion practices. The jury, however, was unconvinced. In 2013, Kermit Gosnell was found guilty of 3 counts of first-degree murder, 1 count of involuntary manslaughter, and more than 200 other offenses. He was sentenced to life in prison without the possibility of parole. The verdict was seen as a victory for the prosecution and a testament to the strength of the evidence against Gosnell. Section 4. Inside the clinic, a gruesome discovery. What investigators found inside Gosnell's clinic shocked even the most seasoned law enforcement officials. The clinic was, in the words of one investigator, a house of horrors. The stench of urine and feces permeated the building. Blood-stained furniture and rusty medical instruments were commonplace. The clinic was littered with the tools of Gosnell's gruesome trade. In the basement, investigators discovered the remains of 47 fetuses stored in plastic containers and bags. These remains, some of which were decades old, painted a grim picture of the scope of Gosnell's illegal activities. The discovery of these fetal remains further fueled public outrage and disgust. The conditions inside the clinic were not just unsanitary, they were dangerous. Unsterilized equipment, reused medical supplies, and a blatant disregard for basic hygiene created an environment ripe for the spread of disease. It's a testament to the desperation of the women who sought his services that they were willing to endure such conditions. Section 5. The Women of 3801 Lancaster Avenue. The women who came to Gosnell's clinic were often from marginalized communities. They were poor, often women of color, and many were recent immigrants. They were drawn to the clinic by the promise of affordable and accessible health care. Many were unaware of the conditions inside or the true nature of Gosnell's practices. These women were victims, exploited by a man who preyed on their vulnerability. They deserved compassion and care, not the horrors they experienced at the hands of Kermit Gosnell. Their stories are a reminder of the systemic inequalities in healthcare access and the desperate situations that lead women to seek out dangerous alternatives. The trauma inflicted upon these women extended far beyond the physical. Many suffered psychological and emotional scars that lingered long after their encounters with Gosnell. Their stories serve as a stark reminder of the importance of safe and legal access to reproductive health care. Section 6. The political landscape. The case of Kermit Gosnell ignited a firestorm of debate about abortion in America. Anti-abortion activists pointed to the case as an example of the horrors of abortion and called for stricter regulations and limitations. They argued that Gosnell's clinic was not an anomaly but rather a glimpse into the dark underbelly of the abortion industry. Pro-choice advocates countered that Gosnell was an outlier, his crimes a reflection of his depravity, not the practices of legitimate abortion providers. They maintained that restricting access to safe and legal abortion would only drive more women into the arms of dangerous practitioners like Gosnell. The Gosnell case exposed the deep divisions in American society over the issue of abortion. It highlighted the need for nuanced and compassionate dialogue on both sides of the debate. The case served as a stark reminder that the fight for reproductive rights is about ensuring access to safe and legal health care for all women,